Hello, this is Michelle Anderson from Southeastern Louisiana University Graduate School of Nursing, where I am pursuing my Master's of Nursing as a family nurse practitioner. I graduated from Southeastern's Accelerated BSN program in 2010 and have worked in a hospital in Baton Rouge on the surgical trauma unit for 2 years, and am currently in the emergency department where I have been for the past year. Today's presentation will be on Dorothea Orum's self-care deficit nursing theory. This is a general theory comprised of 3 related theories: the theory of self-care, the theory of self-care deficit, and the theory of nursing systems. The theory of self-care describes how and why people care for themselves. Self-care is a regulatory function that must be learned and that individuals must deliberately perform or have performed to maintain life, health, development, and well-being. The theory of self-care can be expanded into dependent care, which refers to care provided for the individual who is unable to perform the care themselves. Orum describes 8 self-care requisites that are common to individuals. The first 3 are basic needs required to maintain life and are as follows: sufficient intake of air, sufficient intake of food, and sufficient intake of water. Requisite number 4 is care associated with elimination and excrements, which is necessary to maintain a healthy life. The last 4 requisites deal more with activities related to maintaining a healthy life: balancing activity and rest, balancing solitude and social interaction, preventing hazards to human life, functioning, and well-being, and promoting functioning and development within social groups. The last requisite also includes the human desire to be normal. The theory of self-care deficit depicts how an individual may benefit from nursing. The deficit is the relationship between the self-care demands and the ability of the individual to fulfill the demands. The individual may be able to meet some of the self-care requisites unassisted, but the inability to meet them all is where nursing can help. The theory of nursing systems proposes that nurses perform actions with their patients in order to fulfill the self-care demands of the individual. The nursing action consists of educating the individual, performing some of the self-care requisites, assisting the individual in the performance of the self-care requisites, or performing all of the self-care for the individual. Nurses use combinations of all of the following methods in order to assist their patients: acting for or doing for another, guiding and directing, providing physical or psychological support, providing and maintaining a supportive personal development environment, and teaching. Basic conditioning factors are also included in the concepts of the theory. These refer to factors that influence the ability of the individual to perform self-care in general or under specific conditions. The following 10 factors have been identified: age, gender, developmental state, health state, pattern of living, healthcare systems factors, family systems factors, sociocultural factors, availability of resources, and external environmental factors. There are 5 major assumptions associated with Orum's theory. The first is that individuals require continuous input to themselves in order to remain alive and functioning. Secondly, the power to act deliberately, or human agency, is depicted in the care of self and the care of others. Thirdly, the mature individual may experience limitations in ability to perform self-care. Fourth, human agency is used in discovering and developing ways to identify needs and make inputs to self. Lastly, groups of individuals in some sort of relationship cluster tasks and responsibilities in order to provide self-care for those experiencing deficits in self-care. 3 agencies are also introduced in Orum's theory: the self-care agency, the dependent care agency, and the nursing agency. The acquired ability of mature or maturing individuals to know and meet their self-care requirements comprises the self-care agency. Dependent care agency refers to the acquired ability of an individual to know and meet the self-care demand of a dependent individual. It may also refer to the regulation of the development and exercise of the dependent individual's self-care agency. The nursing agency is comprised of nurses that perform acts and assist individuals in meeting their self-care demands. The nurse may also regulate the development of their self-care agency. This is my model of Orum's self-care deficit. In the most general terms, Orum's theory is that individuals engage in self-care in order to maintain a healthy life. When an individual is unable to meet the requisites of self-care, deficits occur. These deficits may be related to environmental, physical, or mental factors. Nursing comes into play when the individual is in a self-care deficit. The nurse is able to employ helping methods to assist the individual in achieving self-care. In circumstances where the individual is unable to achieve self-care, the helping methods may be passed to another individual who may be able to assist in the care of the individual in deficit. Orum's theory is important to practice as it gives a framework in which the practitioner can assist individuals in either maintaining their own self-care, achieving self-care, or in finding resources to allow the dependent individual to have self-care needs met. The self-care theory is holistic in that it takes into account the patient and the environment surrounding the patient. Education for the individual is paramount in order for there to be successful return to self-care where deficits exist. In the event of a lack of deficits, the practitioner is able to educate on health promotion in order to keep the individual at a level to maintain their own self-care. These are some examples of Orum's theory in practice. The first is Simmons in 2009 discussed the use of Orum's theory in the care of dialysis patients. Dialysis patients must undergo lifestyle changes in order to maximize health. Those patients that are new to dialysis are in the self-care deficit as they do not have the necessary knowledge about the disease to make the required lifestyle changes. Some of the changes include dietary restrictions, fluid restrictions, medication regimen, vascular care, and recognizing signs and symptoms of complications. The road to establishing self-care for these patients involved establishing a nurse-patient relationship, staff supporting the patients, teaching coping mechanisms, continuing disease education by the practitioner to the patient, and encouraging patient participation in the process. All of these methods allowed the patient to achieve as much self-care as possible and to maintain that level of care throughout treatment. This use of the theory translates directly into practice. The nurse practitioner would be able to implement all of the methods used in the study to assist a variety of individuals in their care. In this study, Fleck used Orum's theory to illustrate how obesity puts an individual in a self-care deficit, as the overweight patient is considered to be outside of the parameters of normalcy. Young and middle-aged adults strive to lose weight in order to be normal. Fleck states that it is considered easier to conform to the norm than to be outside of it. A practitioner would be able to incorporate this into their practice very easily, as the overweight patient does fall into a self-care deficit according to Orum's theory. The practitioner would be in a position to educate the individual on the risks of obesity to maintaining optimal health. The individual could also be educated on the variety of health issues that could arise from obesity. Advising the individual on lifestyle changes and offering encouragement to begin the change is part of the duty of the practitioner. Crabtree, Stewart Shore, and McAllister used the self-care theory in a study on home blood pressure monitoring. Using the study as a guide, the nurse practitioner can educate the patient on the need for blood pressure monitoring while also explaining the risks of uncontrolled blood pressure. After instructing the patient how to properly monitor their blood pressure, the nurse practitioner is able to allow the patient to take control over the monitoring of the blood pressure. The patient is empowered by having control over an aspect of their health, and the nurse practitioner is gaining assistance from the patient in managing their health care. The same approach can be applied to patients who wish to stop smoking, as done by O'Connell. The nurse practitioner would be able to provide education about the hazards of smoking, information about health issues surrounding smoking, and use evidence-based methods for smoking cessation. By giving the power to the individual patient, the nurse practitioner is allowing the patient the choice of maintaining their current level of self-care or achieving a higher level. The patient is in control of their own self-care. The self-care theory allows the nurse practitioner to enable the patient to take control of their own health, whether that be maintaining a healthy lifestyle or making up deficits detrimental to their health. Each patient's situation is unique. Therefore, a tailored approach is necessary to maximize quality patient care. Nurse practitioners practice in a variety of settings that would allow for Orum's theory to be employed. The theory also supports a holistic, patient-centered care that is the main aspect of this future nurse practitioner's personal philosophy. In using this theory, the nurse practitioner is able to use evidence-based practice to provide education to the patient, promote healthy lifestyles, assist the patient in changing unhealthy habits, encourage patient safety, and practice in a patient-centered environment. All of these will promote a caring environment for patients and will allow the nurse practitioner to properly care for individuals. And these are the references for this presentation. Thank you.